Coming up next on It's Personal, seasonal affective disorder. It's much more common than you might think. You'll learn more about seasonal affective disorder. Also, lung cancer screening for patients at high risk. It's now available at Gundersen Health System. Find out how insurance, though, might be covering it in the future. And later, holiday eating, or maybe we should call it overeating. When it comes to the holidays, what to eat, how to eat it, and learn about your holiday eating plan. That's all next on It's Personal, brought to you by Gundersen Health System.
Wow, what a great game. But that meatball sub, it sure gave me heartburn.
You're sweating and breathing kind of hard. Are you sure you're okay?
So I got a little worked up over that last play. What are you, a doctor or something?
No, but I read that chest pain from a heart attack can be mistaken for heartburn. Does it hurt anywhere else?
My arm aches some, but armchair quarterbacking is a tough job.
That's it. You're going to the ER.
Is it heartburn or a heart attack? Gundersen Health System urges you to learn the difference. It could save a life. Go to gundersenhealth.org/chest-pain.
Welcome back to It's Personal, brought to you by Gundersen Health System. I'm Chris Stauffer. Well, seasonal affective disorder is much more common than people might think. Joining us to talk more about that is Christie Harris. She's a wellness education specialist from Gundersen Health System. Welcome.
Thanks for having us.
More common than we think, or rare?
Probably more common than what we think. There is about 4 to 6% of the population in the United States that are actually severely affected by seasonal affective disorder, and about another 10 to 20% of the population that are mildly affected by it as well.
Seasonal affective disorder is just, the lack of light? Sunlight?
Typically it can be, although we actually can have, in rare instances, some people that have seasonal affective disorder that can occur in the summer as well. We just typically, in this area, tend to hear a lot more about it during the winter months because it affects a lot more of us during that time.
You mentioned this area. Why this area?
So what happens is our seasons change. We don't get a chance to get out as much. Some of those fresh fruits and vegetables that we enjoy so much during the summer that are good for us, not quite as readily available, tend to get a little bit more expensive for some people's budgets. There's a lot of things that can happen during the winter that changes our routines. And because it's so cold and it's hard for us to get out, it can definitely affect those of us in the more northern areas.
Right. We don't get the sunlight that we had because we're coming up on December 21st, which is the shortest daylight day of the year. And again, that's important for us to get the vitamin D out of the sun.
Absolutely. And important to remember, too, that this year we had a really early start to our winter, too. So important for folks that if you know you might have a tendency to be more prone to this, definitely important that you get it checked out and talk to your provider.
So what are the signs and symptoms of having seasonal affective disorder? How do I know I have it?
A lot of the signs and symptoms that we might associate with depression are things that are very prevalent with seasonal affective disorder. Change in appetite, although with seasonal affective disorder, people might be more prone to crave sweet foods, more starchy foods, lack of energy to do things, lack of concentration, you lose your ability to really enjoy the things that you used to enjoy doing before. So again, a lot of the very similar signs and symptoms that we would experience with depression.
You mentioned talking to your provider about this, but what is the provider going to say? What kind of treatments are out there? What are we aware of that helps avoid seasonal affective disorder?
So for the folks that just have mild condition of it, typically those folks might be able to just get away with watching their diet, making sure they're getting plenty of exercise, just taking good general care of your health. They might be fine. For other folks, they might find that maybe they need medication. Maybe they might need to see a therapist and they might need to do talk therapy. For other folks, there is actually light therapy. As you mentioned, part of it is we lose some of that light that we're used to seeing. So there is light therapy out there, treatment that people can participate in well. Some people might be able to just do one of those. Some people might need a combination of all three of them.
Now, I'm sure there's somebody out there listening, Christie, that says, hey, I need to go to the tanning bed, and that's going to solve my my seasonal affective disorder. But that's not the right
That's
way to
not
go.
the right type of light therapy that we're looking at. Yeah, so we don't we don't encourage folks to hit the tanning bed if they think that that's going to help cure their winter blues.
Then you're just going to upset your dermatologist.
Yes.
All right, we're talking with Christie Harris. She's a wellness education specialist with Gundersen Health System, and we're talking specifically about seasonal affective disorder. When it comes to this, how long has this been around? Is this something that has been affecting people for a long time? Is this something that is just relatively new?
I think it's something that's been affecting people for a long time. I think what's important is that as time goes on, the more that we're realizing that any type of mental health concerns that people might have, it's okay to talk about those things and that you're not alone. As we talked about earlier, 10 to 20% of the population can suffer from mild symptoms of seasonal affective disorder. So I think we're getting more used to being open and being able to talk about these things. So I think that's a big contributing factor to becoming more aware of it.
I'm sure there's somebody listening to this program saying, yeah, but telling somebody that I think I might have seasonal affective disorder might be a little embarrassing.
I don't think there's anything to be embarrassed about it. If you could have an opportunity to feel better by just bringing something up to a provider and talking to a specialist that might be able to give you a few suggestions, or again, in some cases, maybe it might be a medication or it might be going and talking to somebody about it. The ultimate goal is that we feel better and that we're healthier through the process of it. Those with mild cases, maybe not such a severe thing for them to work through. However, with those that have a severe case of it, again, we're talking 4 to 6% of the U.S. population, very important and absolutely nothing to be ashamed, nothing to be embarrassed about, because it really can have a major impact in their overall life and health.
We should talk maybe a little bit more about the demographics themselves. You mentioned 4 to 6% of the population. Is that older folks who maybe are not getting out as much in the wintertime, told not to even maybe do things like shovel their sidewalk because it could, cause problems for them as well, from back injuries to slips and falls and that kind of thing? Or is it also young people? What are the demographics like?
So typically, not saying that we don't see it in young adults or in teens, but not as prevalent. Typically, once we reach the age of 20, then we tend to be a little bit more susceptible to being diagnosed with this. If you've had a previous history of depression or the winter blues or seasonal affective disorder, then definitely you are more prone to having reoccurring episodes later on in life.
Christie, are there other tips that you might have for someone to help them avoid seasonal affective disorder, even if they just sort of have the early signs of symptoms, so that they don't have to talk to their provider, although you would encourage that? Is there something that they can do at home?
Absolutely. First of all, like you said, talking to a provider is the number one thing that you should do so that you can make sure that it isn't something more severe than what you think it might be.
But in the meantime,
some of the things that you can do is make sure that you're watching your diet and exercise. The better you take care of your body, the better it's going to be there to help you get through the season. And then there's some things that you can do that just are general nice things that can make us feel better. Helping other people, for instance. This is a time of the year where we talk about being grateful for things, being thankful for things. So maybe it's doing something nice for a neighbor, or maybe it's going and volunteering at some of the food shelves, or maybe it's your neighbor down the street that's having a hard time doing the shoveling, and maybe you go over to snowblow out their driveway, whatever the case may be. Sometimes by us giving back to others, it's a nice dose of that feel-good endorphins that help us to feel better about ourselves and to be able to get through some of these longer seasons, because we feel like we're contributing and that we're being worthwhile.
And we all want to avoid those winter blues.
Absolutely.
All right, Christie Harris, again, Gundersen Health System, Wellness Education Specialist. Thanks for joining us.
Thank you.
When we come back, we're going to be talking about lung cancer screening. Gundersen Health System is making it available, and insurance may soon be covering it. We'll explain when It's Personal continues.
Are you confused by all the talk about the healthcare marketplace and insurance exchanges? There's just one thing you need to remember. Gundersen One. It's a new option from Gundersen Health Plan, which is locally owned and operated. If you need to purchase health insurance for yourself or your family, Gundersen One offers a choice of plans to fit your budget. To learn more or to enroll, visit gundersen1.org or call the Gundersen Health Plan Enrollment Center at 608-775-8092. That's 608-775-8092.
Welcome back to It's Personal. I'm Chris Stauffer. Well, Gundersen Health System is now offering a lung cancer screening for patients at high risk. The organization offering the screening for those individuals, and there might be private insurance coverage now. And here to talk a little bit more about that is Dr. Kurt Oettel from Cancer Services at Gundersen Health System. Thanks for joining us.
Thank you, Chris, for having me.
So this is kind of a big deal, lung cancer
is.
screening. Talk about, first of all, why has this not been covered by insurance in the past?
Well, in the past, we never had a good screening tool.
Okay.
The problem is that lung cancer, although it affects more patients than any other cancer, we've not had a good way to detect lung cancer. And over the past couple of years, we've really found that CT screening really does make a difference. One very large trial really proved that point. So recently it's been getting that across to insurance companies and having that become standard of care.
We know that obviously catching cancer at early stages means better survival rates, that kind of thing.
Correct.
I'm assuming when we talk about patients at high risk, we're talking about smokers?
We are, yeah. So the trial that really put this on the map looked at patients ages 55 to 74, I believe. And what they did was a yearly CT screen versus a chest x-ray, and found that CT screen indeed does catch cancers early, and cancers that can be curable, which is not something we've ever seen in the past.
As a cancer services provider, a cancer specialist, it's got to make you happy.
Very, very, because the sad part about lung cancer is that up to 3/4 of all the patients who come in who have this diagnosis have it in late stages where it's not curable and survivals are quite poor.
We're talking about the fact that insurance, private insurance, has now kind of come on board with covering this lung cancer screening. Can you give us a little history of how this all came about? Because, as you said, this is a big deal for a lot of people listening to this program today.
Exactly, because if we step back, the people that sort of look at screenings, the U.S. Preventative Task Force, they basically look at treatment options, screening, and they assign it a grade. And lung cancer screening was assigned a grade of a B maybe a year or so ago.
And that's good news.
And that's good news. However, not all insurances, including Medicare, doesn't necessarily have to follow, ironically, what the U.S. Preventative Task Force says. So Medicare had initially said, no, we're not really going to screen or pay for screening yet.
And maybe we should point out Medicare is kind of the big dog in the room when it comes to
Medicare is the elephant in the room, absolutely. Yeah. So what could theoretically happen is you could be 64 and be required by your insurance company to have lung cancer screening or provide that and turn 65, and Medicare says, no, we're not going to do that. So just recently, despite Medicare's advisory board that had looked at this issue several months ago, had said, we're not really sure lung cancer screening makes a difference in the Medicare population, Medicare came out and said, nope, we're going against the advice of our advisory board and we are going to cover lung cancer screening. So come January this year, Medicare will provide coverage for lung cancer screening. And based on that, most private insurances will follow suit.
Sort of a ripple effect, if you will.
Absolutely.
So now at Gundersen Health System, lung cancer screenings are available.
That's correct. So like many other institutions across the country, we realize this saves patients' lives, and it's the right thing to do. So for patients who are at high risk, to get screened, to find out if they have this disease, whereas if it's caught late, we just don't have the curative options that we do when it's caught early.
Talk about what the test is like. You mentioned a CT scan. If I'm coming in to get a lung cancer screening, what do I need to brace myself for?
Really nothing.
Okay.
It's a CT scan is basically lying on a table and going through a scanner. It requires no prep like a colonoscopy. It's not necessarily an uncomfortable test, perhaps like a mammogram. There's no invasive needles that need to be done. It's not claustrophobic like an MRI. Takes very little time. The downside, because there can't always be ups.
Oh, sure.
Yep. So the downside is that much of what is seen on a CT scan that is abnormal is not cancer. And therein lies the rub, because it's trying to figure out what's cancer and what isn't cancer. So many patients will get a CT scan and will find abnormalities that require observation, sometimes invasive procedures to biopsy, but the vast majority of time those findings are negative. They're not cancer.
We're talking with Dr. Kurt Oettel, Gundersen Health System Cancer Services, and we talk about smokers a lot of time in general, and maybe getting that lung cancer screening. But is there demographic even? Is there a narrower window of who should be getting that screening?
Yeah. So looking at the studies that we follow, that we really have to look at right now to say this is a high-risk population, are patients who've had a 30-pack year smoking history. So a pack year is if you were to smoke 1 pack a day for 1 year, that's a pack year. And patients who have accumulated a 30-pack year history or greater are eligible for this. So if you smoke 2 packs a day for 15 years, but quit 10 years ago, just having the history of a 30-pack year smoking history or greater, that's the population that we're looking at. Whether they're current smokers or previous smokers. In fact, what's ironic about this is the majority of patients who get diagnosed with this disease are former smokers. People have quit years, sometimes decades ago.
Interesting.
Yeah.
Talk a little bit about lung cancer. Used to, if I recall, and correct me if I'm wrong, Dr. Oettel, the diagnosis of lung cancer was fatal previously.
Yeah.
No?
Yeah. So it's always been sort of in the basement in terms of survival rates, and unfortunately, we've made strides, but they're not big strides. They're not big strides like we've seen in other diseases. We have hope that in the future, especially with many of the new treatments and many of the sort of parsing out of various types of lung cancers, that we're going to make much bigger strides in the future. But the biggest stride that we can make, far and away the biggest stride we'll make, is catching this disease earlier, so that patients are in a curative setting. And what that will really do is what it's done for other cancers is it's going to create a climate of advocacy. So more patients who are early stage lung cancers will then become advocates for this disease. And this is a disease, it is really lacking in advocacy relative to other types of cancers, and especially for the volume of people. Because again, this cancer population dwarfs any other cancer population.
And I got to imagine that a lot of that is due to the stigma around smoking. Hey, you did this to yourself.
Absolutely. In fact, it wasn't long ago that we actually did a clinical study in conjunction with UW looking at that very issue, the stigma of having this disease. And far and away greater than other types of cancers, if you have a stigma, you're not prone to become an advocate. You're not prone to become an advocate for yourself or anybody else. You're not likely to enter on to clinical trials. You're not likely to want to get treatment. In fact, this is one disease where patients may get this disease and say, I'm done. I don't want to do any treatment.
Dr. Oettel, we're out of time, but I do want to give you the opportunity to say if I'm in this criteria where I should maybe think about getting a lung cancer screening, where do I go?
You call Gundersen.
Okay, call Gundersen Health System and
Yep.
ask your provider, I would assume.
Yeah, absolutely.
All
Yep.
right. Dr. Kurt Oettel, Gundersen Health System Cancer Services, thanks for joining us.
Thank you, Chris.
When we come back, we're going to talk a little holiday eating. Yes, don't overeat. We'll tell you why. That's next when It's Personal continues.
Between kids, the dog, working, and housework, it's hard to know where it all ends sometimes. But when it comes to your family's health, Gundersen Health System is where it begins. We understand you lead a busy life. That's why we provide most of the care your family will ever need, right nearby. From annual exams and broken bones to treating illnesses and chronic conditions, Gundersen is where health begins for your whole family. Need a primary care provider? Visit gundersenhealth.org/families.
Welcome back to It's Personal, brought to you by Gundersen Health System. I'm Chris Stauffer. Well, holiday overeating. Yes, overeating. It happens to most individuals, it seems. How do you deal with it, and how do you plan for it? Or plan around it, maybe, is the case. Joining us now to talk about that is Valerie Pampuch. She's a registered dietitian with Gundersen Health System. Welcome.
Thank you for having me.
Overeating, let's face it, with Thanksgiving now behind us, there's a lot of people who are going, I don't want to do that again at Christmas. How do you avoid it?
Well, know what your triggers are, stay active, and keep on with a healthy eating regimen, eating your vegetables, your fruits, lean stuff. Don't deprive yourself.
When you think of holiday eating, though, a lot of times you go, sweet potatoes, that's not bad, that's good for me, but then it's covered in marshmallows or those kind of things. How do you get around, some of those kind of things?
If you can pick, one thing every day to indulge, that's one trick. But you don't have to eat everything on your plate. I know that's an old rule. But sweet potatoes are really good on their own. So if you want to have them plain or doctor them up afterwards, but just be mindful that those sugar calories add up very quickly.
One of the things that you just mentioned there is that old rule. You tell the kids, hey, clean your plate, and you load that plate up with just about everything you possibly can. Sometimes they don't even like it, and you're asking them to clean their plate. What's the philosophy behind the Don't Clean Your Plate Club?
Well, those foods aren't going out of style. They're going to be made again, and I think that that's one of the things that gets into people's heads, like, this is like very special, and it should be. But just take the right amount. You can always go back for more, but just take a sampling of everything on your plate, and maybe even use a smaller plate, and that can help maintain a good calorie count.
Why a smaller plate?
If you can make it look fuller, then it appears as though you're having a lot more. It's definitely something that is effective, studies have shown.
What do you say to those folks who are out there who are preparing the meals, they're getting things together? What about, as we said, just adding maybe onto healthy foods, adding things that aren't so healthy to those healthy foods? Make sense? What's your advice there?
Well, you can always add, maybe not to every recipe, but if you can incorporate something healthier like a vegetable, that can add a lot of bulk to that dish, a lot of water content, so it ends up being that you feel fuller faster from that, and also it has probably more fiber.
Let's talk maybe about a few things that are out there that are on a typical maybe holiday meal. A lot of times it's turkey or ham. Are those good for you? I mean, there's protein involved.
Yeah, they're great for you. When they go into that not so great for you category is when we add a lot of gravy to them, or if we add a lot of sugared things, or if we just eat too much of it. It can be a great food for you, but you can overeat good things. Too much of a good thing.
All right, mashed potatoes and gravy.
Awesome, love that.
Okay.
But it's the same thing. A lot of times we overeat those carb or those starches. But I will say on the positive side is potatoes got a bad rap. However, they're full of really great things. They're a whole food, they're a natural food. When they become, when we mix them with a lot of butter or sugar, like those sweet potato things, that's when we start adding calories. And you can definitely still do those, but just be mindful that that's there, and watch the portion size.
Stuffing.
It goes into the carbohydrate category, starch category. If you have celiac disease, definitely stay away from stuffing. But just watch the portion size.
All right. What about just a couple of other staples, things like cranberry sauce and, maybe the dessert, all the holiday cookies?
Sure. You need to have those treats And that's just part of our culture, and you shouldn't deprive yourself, but again, moderation is key. So have a cookie and then, call it a day. You had your cookies. So you
Throw
can
them
have
in the freezer.
Yeah, you can have your cake and eat it too, or send the rest home with, the college kids or family members, or put it in the freezer. That's a really good option too. But yeah, you have to have those things too.
And then another holiday staple is alcohol, wine, beer, and of course, liquor.
Yep. Those are things that have no nutritional value in them. Yes, they're a lot of fun, and you'll probably have those over the holidays. But just be mindful that they are empty calories, and those calories add up very quickly.
Okay, empty calories. Explain what an empty calorie is.
Empty calories are things that do not offer any vitamins, minerals, things like that. So we call alcohol liquid fat just because for every gram of alcohol, we get 7 calories out of it. So an ounce of alcohol, which is in an alcoholic drink normally, is a lot of calories.
All right, some good holiday eating advice there. I know that you have advocated for having a plan when you go into a holiday event. Sometimes even just eating beforehand is a good idea.
Oh, definitely. Don't deprive yourself of meals throughout the day trying to quote-unquote bank your calories. Mm-hmm. That's something that does not work. You'll probably go into that party not being, very friendly because you'll probably be very hungry or hangry. Mm-hmm. So, eat accordingly like normal throughout the day. But as far as having a plan when you go in, if I know the house and I know that Aunt Yvette is going to have caramel popcorn balls, well, that's where I'm going to spend my calories. The other stuff, I might taste, but that's my ticket item that I want to splurge on. Otherwise, I'm going to try to eat something wholesome, something with color and moderation on everything.
So no matter if it's Thanksgiving or any holiday party, always eat breakfast before you go, right?
Oh, of course. That gets your engine running. It starts your day. So definitely don't skimp or skip that meal.
All right, and I know that you've said it will help you not to be hangry when you go there. And of course, when there's relatives around, nobody wants to be hangry.
Definitely not. And normally when you get to a party or, a big meal like that, the first thing you're served is alcohol. So if you go in there with an empty stomach, you're going to feel that alcohol immediately, and then that might make you sick, and it might, just emphasize whatever emotion you're feeling.
We're talking with Valerie Pampuch. She's a registered dietitian at Gundersen Health System. We're just about out of time, Valerie, but I know that there is some new regulations that just came out, I believe from the FDA, and they take place, they actually go into effect in November of 2015. And can you explain what those new regulations are and how they affect businesses?
Sure. So if you have a restaurant or anything with quick serve foods, so this applies to the theaters as well, so anything with popcorn, pizza, things like that have over 20, they have to label the calories now. They do not have to label, saturated fat, carbohydrates, things like that. However, that information needs to be available. Vending machines will also be a part of this. However, they get an additional year, so in 2016 is when you'll see the calorie counts for sure. You'll probably see it earlier. However, that's the deadline.
All right. So some good information there for local businesses who may be impacted in 2015 with new regulations from the FDA.
Yes. So if you're a mom and pop store, you do not need to label because you do not have 20 or more. This is also a benefit for those places like that have stores in multiple states that have different regulations. Now this will be a singular regulation so everyone can abide by the same rules.
All right, that makes sense. So you're not having to do it 15 different ways.
Right. And then it becomes confusing to the customer as well. Say you travel a lot, then what number do you look at? So hopefully this helps people make the wiser choice.
All right, Valerie Pampuch, registered dietitian, Gundersen Health System. Thanks for joining us.
Thank you.
All right, and happy holidays to everyone. That wraps it up for this edition of It's Personal. If you'd like any information about any of the topics covered on today's program, you can go to the Gundersen Health System website. That's gundersenhealth.org. Thanks for joining us.